Welcome to SGT Times Explainer. I am Arash. Today, we will talk about why people are not getting sick with the COVID-19 virus. During the first 3 weeks of the month, more than 3 lakh positive cases were found per day on average. Daily detections peaked precisely 3 years ago, on May 6, 2021, with more than 4.14 lakh positive cases recorded. It seems like a distant memory today, but just 3 years ago, India was experiencing the worst of the COVID-19 outbreak. More than 1.2 lakh people died in May 2021, accounting for almost 20% of all COVID-related deaths in the country to yet. During the first 3 weeks of the month, more than 3 lakh positive cases were found per day on average. Despite a steady drop in cases and deaths, the crisis lasted at least 2 more months. Unlike many other nations, India did not see any further deadly COVID-19 outbreaks. The Omicron wave of January-February 2022 resulted in a large increase in infections, although not many serious cases or deaths. And while a few instances are still being recorded, 850 active cases as of Friday, according to the Health Ministry, the pandemic no longer poses a severe concern. Is the COVID-19 epidemic finally over? On May 5, 2023, the World Health Organization declared COVID-19 no longer a worldwide public health emergency. It was a recognition that the virus' uncontrolled spread had over, that it was no longer causing major infections, hospitalizations or fatalities, and that it was no longer putting a strain on public health systems in most countries. The announcement was interpreted as a formal end to the epidemic. After March 31, 2022, shortly after the Omicron wave dispersed, India lifted all COVID-19 related limitations and stopped enforcing the Disaster Management Act regulations. As a result, state governments abolished laws requiring masks to be worn in public places. However, SARS-CoV-2, the virus that caused COVID-19, is still in circulation, causing illness and even fatalities. The main variety now producing the most infections is JN1, a distant cousin of Omicron. JN1 is slightly more effective at infecting individuals than its sister's variations. But like all Omicron descendants, it does not cause serious illness. According to WHO figures, in the 4 weeks preceding April 14, more than 2.42 lakh positive cases were recorded worldwide, with Russia and New Zealand accounting for more than 2/3 of the total. Approximately 3,000 instances were documented in India. In the same period, around 3,400 fatalities have been related to COVID-19, about 2,400 in the United States and 53 in India. India continues to report double-digit instances despite very little testing. On Thursday, 50 cases were found. In Kerala, there was even a death. A few labs have been monitoring the virus spread, primarily using wastewater surveillance and hospital sample collection. These labs are the Translational Health Science and Technology Institute in Faridabad, National Institute of Virology in Pune, and the Center for Cellular and Molecular Biology in Hyderabad. Monitoring of wastewater has also shown that the JN1 variety is present in India. Why isn't the COVID-19 virus spreading more widely? Low detection rates may be the result of very few persons getting tested. The fact that COVID-19 hasn't posed a serious health issue in the previous few years might be attributed in part or luck or coincidence. When the Omicron strain first appeared at the end of 2021, it was more capable of spreading and infecting humans. Although it did not result in a serious illness, after contracting Omicron, a sizable fraction of the global populace developed innate immunity. More than half of the world's population had gotten 1 or more vaccines by the end of 2021, which boosted their immunity. The virus has less opportunity to quickly develop into novel varieties due to the fall in the proportion of patients without protection from natural infection or vaccination. Nevertheless, vaccinations or natural infections do not offer lifelong immunity. vaccines administered in 2021 and 2022 are most likely no longer effective. After a while, natural immunity also wanes. People are still contracting relatively benign varieties and ruining their immunity, which is the only reason there isn't an uncontrollably high increase. That appears to be precisely what is taking place. Individuals are becoming affected, potentially in significant numbers, because not many tests are being conducted. We don't know. However, throughout this process, their innate immunity is renewed and strengthened. According to Anurag Agarwal, Dean of Ashoka University's Trivedi School of Biosciences and Health Research, in the meanwhile, it has been very beneficial that the virus has not evolved into a more hazardous form. One can only speculate as to how long this predicament will last. Scientists and public health professionals, on the other hand, are no longer ignorant of the virus. They have a far better grasp of it and know what to anticipate as well as strategies for controlling its spread. Nonetheless, to make prompt responses, the strains that are in circulation must be continuously watched and observed. That brings us to the end of today's SGT Times Explainer. Thanks for watching.